Hello, everyone, and welcome to week 5 at Prevention, Education, and Current Trends. This is a really important topic to understand. The field of prevention, when we're talking about behavioral and substance use disorders, is really important. The goal for prevention is to prevent the onset of the disorder or prevent those severe disorders. We do that is information, and so you'll see a lot of information that's put out there, particularly SAMHSA NIDA has a lot of the evidence-based intervention for families, for children, for teenagers to really understand the effects and the impact of substance use and different behaviors on an individual's life. And so this is science-backed information that are helpful. They're helpful for resources. And helpful for you to figure out kind of how to apply in your setting. And it may not be you directly, but you may know of others or recommend someone engage in different prevention programs that are out there. A lot of schools are doing specific prevention programs to put the education to children and teenagers so they can make more informed choices in the future. One of the things that's really important to understand that how vulnerable adolescents are. It's the brain changes. You know, the brain is an important component of that. Well, adolescents' brains are growing, changing rapidly. One of those changes that that we know about is the drop in dopamine, and because of that drop, it's one of those reasons that there's this kind of sense of like boredom all the time, right? And that's really a brain response, that the brain isn't getting enough dopamine to be excited or very interested in much. And so it's during this time that adolescents really seek out different ways to gain excitement and may engage in more high-risk behaviors because it does change the brain in a way and having those little boosts of excitement. And so substance use is one of those ways, or even engaging in social connections that are focused on those high-risk behaviors. And so that's why this population is particularly vulnerable for beginning the use of that could turn into addictive behaviors. So that's another reason that prevention at this age is really important. The more they can understand about their brain and how their brain is changing, and healthy ways to increase dopamine, healthy ways to help their brain develop so that, you know, as they get older, their brain is functioning optimally. Often when these teenagers really understand it from a place of a healthy brain, they're more likely to maintain healthy behaviors. So that's a perspective that's really important. And some of the research that we're understanding now too is that the age of onset that someone starts using a substance is a bigger predictor of developing a substance use disorder as an adult than even genetics. So we focus so much on genetics in the past and family, that if you come from a family with individuals who have substance use disorders, then you're likely to develop one or be more vulnerable to developing an addiction disorder. Well, now we know the age of onset, even if you have no one in your family, but you choose as a teenager or a young or preteen even to begin using, and that cutoff seems to be before the age of 12 or around the age of 12. But the younger they begin to use, the more likely the predictor of a later severe disorder. And so prevention is the goal, is that we can help educate kids to not engage in those behaviors so that then there isn't a bigger problem later. And so a piece of that, you may be working with families, you may be working with adults who have children, or you may be working with children, adolescents, and even if they're not coming to you to talk about addiction disorders or substance use, it's important to talk about introducing substances or those risky behaviors at a young age really could alter their brain for their entire life, making them more vulnerable to different problems later. So that's just important information to know. Why is prevention important, right? So another piece that we talk about this week is kind of those current trends. And so that's going to change, right? Because it's current. A few of the things we're understanding more and more about. One is the rise in opioid use disorders. This really significant epidemic in our country and other areas of the world. Understanding the death rates among those who deal with opioid use disorders. So looking back, we really see how the prescriptions were prescribed. They were legal, they were taken legally, yet even starting with a prescription medication got out of control and led to a more severe disorder. It's very common that someone will trace back, even if they're currently using heroin, they'll look back and recognize that it started with a legal prescription. And so that's a current trend right now, is really putting a lot of resources and effort to understanding opioid use disorders and finding effective treatment, which often involves the use of different medications. And so it's really important to know, and we'll talk a little more about that throughout the course of what are effective medications, what are some of the risks and benefits of that. So even if you're not prescribing the medication, you may be collaborating with others, and your client is going to look to you to help them make those informed decisions. Not that you would necessarily make those recommendations, but you would help them know where to research and find information to help them make that choice. Another current trend is looking at the effects of the legalization of marijuana. And we're seeing in different areas of the country where it is legal that there are still significant problems, particularly with teenagers who now are beginning to use at an earlier age. Similarly, as the brain is changing, you introduce any substance at an early age, and it's going to alter the way that those neuronal pathways develop, which will be significant over time. And so one of the challenges is working with anyone with a substance use disorder is understanding the seriousness still of marijuana use, because it's becoming legal in many areas. People aren't taking it as seriously or really considering the potential effects of what marijuana can use to do to the brain and the body. And so it's another place we want to educate people, specifically, how does it change the brain? How long do those effects last? How long does it take to get out of the brain? And so it's important for us to know that information. It has made it harder even dealing with adolescents who don't live in states that are legal, that they're looking at those states saying, well, see, it's not that big of a deal. And then even parents are loosening their restrictions because of that, and allowing their children to use different substances, particularly marijuana, at an earlier age, because it doesn't seem to be as serious as it used to be. So that's something that we need to stay current on and follow that research so we can provide more informed information to the clients that we're working with about those effects. So there are a few other current trends, but really as a counselor, it's part of your professional responsibility to stay up on that information and to see what's new, what the research is saying. The SAMHSA and NIDA websites are really good for maintaining those current trends. So enjoy reading about that information. You will have an assignment to review a few prevention models and talk about several factors with those prevention models, and make sure you take a look at how those are outlined in the textbook, and then look for additional resources if you want to know more to help you with that assignment.